Hey guys, welcome to the Aging with Innovation podcast. We're exploring today, groundbreaking solutions to help people age with dignity, with independence, and most importantly, hope. I'm your host, and today we're going to be diving into a topic that is absolutely critical when it comes to healthcare providers and patients alike, which is chronic wound care. So if you're in home health, maybe skilled nursing, assisted living, maybe you work for a hospital, or maybe you're even caring for a loved one with a chronic wound, this is going to be an episode that you're going to want to listen to. So my aim today really is to uncover some of the challenges, the pitfalls with traditional wound care. Talk about some success stories, some of the things that we've been able to do, and more importantly, our approach that we take at Rebirth Advanced Healing. So stick around. We are going to be talking about some things that could change your perspective, change the way that you think about traditional wound care. So why don't we just kind of call out the problem first? And these are chronic wounds like pressure sores, diabetic foot ulcers, venous stasis ulcers. These wounds affect 10.5 million Medicare beneficiaries. And that's over 16% of the Medicare population. And these numbers are growing year after year. These aren't just cuts or scrapes. These are wounds that refuse to heal for months and sometimes even years, especially as in these older adults, the ones with comorbidities like diabetes, cardiovascular disease. I saw a stat that even 25% of military vets on Medicare have diabetes, and 53% of wound care patients have cardiovascular issues, both of which make healing tougher and sometimes almost impossible because of these comorbidities. And for, I guess, healthcare providers, they know how much of a nightmare these chronic wounds are because they're driving up the hospital readmissions. And I was reading that patients without regular wound care are 20 times more likely to end up in the hospital, which is going to be increasing, 25 to 40% of hospital beds. And the cost to the system is nearly 28 to 97 billion dollars a year. That's billion with a B. So these are mind-blowing numbers. But what does this actually mean for the patients? I mean, imagine just having this wound that won't go away, or being bedbound in pain with a wound that just won't heal. And maybe you're scared of infections, amputation, or losing your independence even further. And there's often there's this tremendous amount of family stress. I don't think enough people talk about that either. The family stress, sometimes it's financial, it's emotional, and it's not always the direct costs that you see when it comes to dealing with these wounds. It's often the indirect costs. There's sometimes loss of income, caregiver time, the additional expenses. It's just a major frustration. And unfortunately, it's the reality for millions of people. So what I found is that many people believe that just traditional wound care, so maybe going to the clinic, getting regular dressings, bandages is enough, or that the wounds will just magically heal on their own. And the problem is, especially with these comorbidities, most of them won't. And the providers know this, but their resources are stretched. There's long wait times, there's ineffective treatments, and it keeps these patients stuck. It keeps their care stuck in just this vicious cycle. So we often see these nursing shortages, the staff, resources are thin, and it makes it very difficult, especially for these home health agencies, to do the job the way that they want to, the way they know is best for their patients, because they're strapped. They just sometimes don't have the resources. And ultimately, it's the patients that suffer at the end of the day. So what's the solution? What do you actually do about it? And that's where Rebirth Advanced Healing comes in. And Rebirth was founded to break this cycle, put patients first, truly first, because it's our mission to deliver advanced mobile wound care at wherever the the patients call home, whether that's in their home, an assisted living community, a nursing facility, and to be able to provide true collaboration with the home health team, the PCPs, the family, really work with the entire team that is treating this patient. And part of that is the family. So this way, they don't have to bring these patients to the clinic, to the hospital. They don't have to wait weeks for an appointment because, so many of these folks already have a hard time getting out in the first place. Now imagine the logistics of trying to get them to the wound clinic every single week. So here's where we do things a bit differently. And here's how it all works, right? We have wound certified practitioners. These are NPs, these are PAs, MDs that are visiting these patients weekly, right where they are. And we use the most innovative biologic products, these advanced biologics, to ultimately speed up the healing, reduce complications, and provide true collaboration with the care team. So think about this. If you are maybe a home health agency, you're a long-term care facility, a SNF, an assisted living facility, we ensure that your patients or your residents receive the highest quality care from high-level clinicians. And here's the best part about this. It's covered by Medicare Part B, and most patients don't pay anything out of pocket because we take care of the insurance verification. We get our providers out there really quick. So there's no wait list. So imagine we get a referral, we process that referral, and the next day we have an advanced provider going out there to provide treatment for this patient in their home. Now, why does this actually matter? Our approach actually cuts down those costly readmissions, frees up your resources. It boosts patient satisfaction and strengthens your reputation as a home health or an assisted living. But mainly for the patients, it's about reclaiming their dignity, their hope. Because one of the things we say is, while other providers manage customers, we heal patients. And that's with expertise. That's with empathy. Now, a story that comes to mind recently is one of our home health partners actually referred us a patient. This is maybe 2 months ago, a little bit more. This is a gentleman who was mostly bedbound. Sadly, it's a common situation. And he had a massive pressure sore on his hip, like I'm talking over 82 square centimeters. It's about the size of like a small notebook, something like that. And they actually had another wound care provider in there that had been trying to help, but the wound wasn't really progressing. Patient was in a tremendous amount of pain and the family was frustrated. The home health team was frustrated. And they really wanted to find a resource, something that might actually help this patient. So we got the referral, we stepped in, and our wound certified practitioner is a PA, his name is Matt. He went out and visited the home. He created a tailored plan for this patient, working with the home health. First, to do some debriding, prepare the wound for grafting. And then he used a membrane wrap, which is an advanced biologic product. So we worked hand in hand with that home health team. We checked in weekly. We had weekly visits with the patient, collaborated with home health. And about 8 weeks later, I just spoke to Matt last week about this, the wound was already down to under 8 square centimeters, from 82 down to 8, and now on the verge of healing almost completely. Needless to say, that the family was well over the moon. They have not seen this kind of hope in a long time, so they were thrilled. What was amazing, too, is that our home health partner was amazed. They were also thrilled because, one, they didn't have to go out for as many visits, but two, they were starting to see that progress with the patient and in all the worlds of difference. So I share stories like this, and they're very common with our providers because when you're able to combine that expertise, that innovation, truly the patient-first approach, these pressure sores that could have led to infection are starting to heal. These patients are on the road to recovery, and now they have a bit more peace of mind. They feel like there's some hope again. So I love sharing stories like that. And why, I guess, as a healthcare professional, should you actually care, right, about partnering with Rebirth? And if we break this down, if you're in home health, if you deliver exceptional care, right, for your complex patients, you want to reduce your readmissions, You want to streamline this process, right? Or maybe you're in a skilled nursing facility. We're able to get out there and improve the outcomes for your residents, keeping them out of the hospital, saving you costs. And same thing in the assisted living, right? You want to keep your residents there. You want to keep them independent, keep them, keep your occupancy, and improve their quality of life. And so we partner with all of these different providers to make it easy and to improve the quality and the outcomes that you're getting. So again, we really focus on the care coordination piece because our results speak for themselves, but we really have to coordinate that care from front to back. And it's a little bit of something that does set us apart from the multitude of mobile wound care providers that are out there. Because anyone can go out and maybe do some debridement, maybe put some grafts on there, but it takes so much more than that. We have to have those conversations, those weekly or sometimes even daily touch points with the entire care team so that everyone knows what's going on. We're all pulling on the same string together to heal this patient, to heal these wounds, and improve their quality of life. Because ultimately what we want is faster healing. We want happier patients, and we want less stress, not just for the patients and their family, but also for the care teams that are involved. So one of the things that I had read was that about 30% of chronic wounds, of the patients that are out there that are suffering from this, they don't actually heal on an annual basis, which is mind-blowing to me, right? And so what that leads to is a whole host of consequences. So 97% more nursing visits, right? And when we see that, I can't tell you how many nurses in home health I've spoken to. Like, oh, yeah, we've been seeing Mr. Jones, that's a Mr. Random name, for 2 years, right? And we're seeing them on and off, sometimes 1, 2, 3 times a week. And it's just an incredible source of frustration for the care team because these are really good clinicians that know what they're doing. They know how to heal wounds. But when we're dealing with medical complexity, when we're dealing with multiple comorbidities and factors that are beyond the clinician's control that really slow down or negatively impact healing, becomes very difficult and very frustrating. So it's where we're able to come in and assist with that to really start seeing some progress where maybe they hadn't for several years. So again, we take this approach, this patient first approach, and collaborate across the board so that we can help our home health partners, our assisted living facilities, our skilled nursing facilities heal these patients that have had these wounds for quite some time. Now, for the families listening, maybe you or a loved one actually has a wound, right? And you're listening to this podcast and you're saying, okay, I would love for there to be some hope. I've been dealing with this for a long time. I was maybe ready to give up hope that this could actually heal and just thought it was something that I had to live with. And what I want you to know is this: you don't have to live with the pain, the fear, the isolation. You don't have to live with this chronic wound. It is something that likely can be addressed. And we have a multitude of success stories: patients, diabetic foot ulcers, venous stasis ulcers, burn wounds that take up a massive surface area that just didn't seem like they were ever going to heal. And we were able to significantly reduce them and in many cases heal them. Now, I'm not saying we're these magic folks that can go in and heal every single wound, because there's many different factors. But if you're at home and maybe you've been going to the wound care clinic, or maybe you have had home health come in and you've been trying to get this thing healed, it's been there for 3 months, 6 months, a year, 2 years, and you haven't had any progress, well, maybe it's time to try something different. Maybe it's time to seek an alternative that, would give you some hope again. Because once you start seeing the reduction in pain, once you start seeing the wound is getting smaller. And our clinicians are measuring that every single week. And it goes from here to here to here to here. The feeling that you get, the hope that starts to come about, the excitement when you're starting to feel like, man, maybe I can get my life back here. I can move beyond this wound that's been there for so long. Like, that's why we do what we do. It's incredible. It's not about, well, yes, we love partnering with our home health partners and everyone else involved in the case. But when we are able to sit down and have these conversations with the patients, with their families, to see the difference that our wound care is providing, that is the reason why we do what we do. And if there's any little bit of hope or curiosity on your end to try something new, to try something like this, because you've exhausted all other options, well, what have you got to lose? And so that's really the approach. That's the mindset here. And the more patients that we can reach, and it's why I sit here and talk to a screen and talk to you folks out there, is to try and spread this message, because I've seen firsthand the impact that our wound care can provide. And I hate to say wound care because it's wound healing that we do. And if we can help you, we would love to have you be another success story of ours. So yeah, I get fired up about this stuff. I can sit here and talk for hours and hours, and it's fun. I get to have conversations with our clinicians, our other providers, and so forth, and hear their stories week in and week out. So you'll hear me rattle on and on and on about this so that we can continue to get the message out there. So I'd encourage you, whether you are somebody listening to this and maybe you work in senior care, maybe you know somebody, don't hesitate to share our information. Share the podcast with them. Share any of this content here, because what I found is that so many people don't even know that this is an option. So many people don't know that this type of treatment exists. So it's my job, it's our job to be able to spread that word and share with as many folks as possible, because you might know somebody who knows somebody who knows somebody who's suffering with a chronic wound. We saw those numbers earlier, and the millions of Americans that are suffering with these chronic wounds, most of which don't heal over the course of a year, is staggering. So if we can have a small impact on that, you might be able to have a small impact on that just by sharing this information with somebody and saying, hey, go check these guys out. Right? That's what I would encourage you to do. And that's my responsibility that I don't take very lightly, because it's important to me that we're able to provide more hope to the patients out there that are just not getting what they need. We kind of covered a lot today. You heard me talk about a success story. You helped me talk about some of the statistics, what we do, and more importantly, why we do it. So I'd encourage you, at this point, to share this with somebody that you think might benefit. It might be the executive director of a assisted living facility. It might be a caregiver in there. Because if you work in senior care, you probably know somebody that has a chronic. So with that, look forward to diving in next week, next podcast, where we invite some really cool people on here to talk more about the different things, the innovation that is out there in senior care, so that we can present all of these wonderful services to the folks out there. So with that, I'll see you on the next one, and thanks for listening.